Hello, everyone. My name is Peter Gudaitis. Welcome. I'm the Executive Director of New York Disaster Interface Services. And we are going to be spending the next hour together talking about the pandemic and the implications of racial justice and equity in how infections and deaths are occurring here in New York City, as well as the rest of the country. And then a little bit more about how we can begin better communication as congregations and the vaccine announcements are being made and rolling out. You'll be getting information both from us and our staff, as well as staff from the New York City Department of Health and Mental Hygiene and their COVID-19 epidemiology team. I want to specifically explain why we are looking at this from the perspective of racial justice and equity here in New York City and around the country. You are twice as likely to die from COVID-19 if you are a Black American, and you are 1.5 times more likely to die from COVID-19 if you are Latino or Native American. That is not because there's a biological difference in how the virus is affecting people of color. It has to do with the racial constructs of our society and the inequalities and inequities that exist both in how we live and our access to medical care. So as we look at how congregations will play a role in verifying the efficacy of the vaccine and whether or not people take it, we have to understand the challenges that face vulnerable populations and their trust for the vaccine, and also what the science behind the vaccine is, and how we can talk about that in a way that helps inform vulnerable populations as well as the general population about the science of this specific pandemic and this specific vaccine. So I'm going to hand it back to my colleague, Helena Duran, who is on with us today. Helena is our Senior Program Manager for our Faith Sector Community Preparedness Program. I know she's well known to many of you because I see many known faces on our Zoom with us today. She's joined by Susan Palevsky, who is our COVID-19 Program Manager, also funded by the New York City Department of Health and Mental Hygiene Office of Emergency Preparedness and Response through the New York City Health Fund for New York City Health. And they'll be introducing you to our health department colleagues as they join the call. So thank you again for being with us. This is being recorded. We will send you the slide deck and a recording of the webinar if you turn in your evaluation at the end of the webinar. It's a little quid pro quo. We apologize for that, but it's necessary for our contract deliverables and making sure that people are understanding the information that we are sharing. So thank you again, and Helena, I hand it back to you.
Thank you. All right, so some quick webinar orientation for your probably 85,000th Zoom call this year. But just to know that your audio controls, you have control of them during this webinar. The webinar is being recorded. Please mute when you're not speaking to eliminate background noise. If you have any technical difficulties, we put Susan's email there that she'll be monitoring in case you can't get back in for any reason. And please use the chat box if you have any issues. Peter mentioned our evaluation that will be sent out with a link, and through filling out that evaluation, you'll get access to the recording of today's webinar. All right, so we'll dive in. Our guest speaker today from the health department will be Dr. Jennifer Rosen. She's a Vaccine Hesitancy Branch Director of COVID-19 Response at the Health Department, as well as the Director of Epidemiology and Surveillance in the Bureau of Immunization. And they will be on with us shortly. An overview of our materials today is that we'll have Dr. Rosen from the Health Department give us an update on the COVID-19 context to share about the impact of COVID-19 on New York City communities, specifically in communities of color, and how that has been reflected in the zip codes in New York City, and how the Health Department has really tailored their response to COVID-19 based on zip codes. And they'll also touch on the COVID-19 vaccine, what we do know, and she'll be able to share the latest information that the Health Department is sharing in regards to COVID-19 vaccination, both the distribution plans and how their health equity framework is influencing that plan. And then following that, I'll be presenting on congregation emergency communications during this pandemic. We love to hear what you all have been doing and hear creative new strategies of staying in communication with your congregants during COVID-19. And I'll also be sharing some best practices that we've learned along the way, both tried and true, and some new ones that have arisen during the COVID-19 pandemic. We will have time for Q&A, hopefully briefly after Dr. Rosen's presentation. She's able to join us for 15 minutes today. Very busy, but we'll also be able to route any questions that you all have for the Health Department to the Public Information Officer's office, and we'll be able to get those answers to you after the presentation if they are not covered during today's presentation. So I'd like to see if Dr. Rosen has joined the call. Dr. Rosen, are you here? Oh, I see, I am on the call, perfect. If you are able to unmute, I will go ahead and advance your slides for you. Dr. Rosen, if you're speaking, we cannot hear you. Oh, I see you.
Can you hear me now?
Yes, we can hear you.
Perfect, okay. And I'm not sure if you hear the echo that I hear.
Nope.
We don't.
Okay. All right, so if you can go to the next slide. Okay, sorry, if you can go to the previous slide.
Mm-hmm.
Okay, so I wanted to talk about a few things. We at the Health Department have established a vaccine hesitancy branch, and I'm sorry, I'm just going to try and adjust my headphones because of the echo.
Sure. We're also able to only see the top of your head. I don't know if you're able to adjust your camera.
Actually, if you can still hear me, this is.
Yep.
Can you still hear me?
Mm-hmm.
Okay, great. Much better. So the Department of Health has a vaccine section, and we have established a vaccine hesitancy branch specifically to look at factors that are causing vaccine hesitancy and figure out the best ways to address vaccine hesitancy. And I'm so grateful to be included on this call today, because one of the key trusted messengers that we have identified and that we want to partner with are faith-based organizations and faith-based leaders. We know you are trusted leaders in communities and really important sources of information for people in the community. So I wanted to use this opportunity to talk to you about what we know, what we don't know, and would also welcome any feedback either now or after the call in terms of ways we could partner together with your organizations. So the first thing I wanted to talk about was disparate impacts of COVID, and then I will specifically talk about vaccine, as I know that's top of everyone's mind in terms of new news that is coming out. And I want to make sure that you are all armed with the information that you need to know, because people will come to you for your opinions. In terms of sort of background, as was mentioned before, structural racism affects people's health in so many ways, and this has an exponential impact during the pandemic. As mentioned, data has shown that Black New Yorkers are dying at much higher rates than white New Yorkers. And this really affirms longstanding structural racial disparities that affect access to various things like health insurance, housing, gainful employment, and much more. Structural racism impacts people's where people live, the state of their housing, relationship with the government, and authorities such as the police. And so the city, our response will be guided by equity and community at the forefront of everything that we do. And we need all New Yorkers to be a part of this, whether it's to follow guidance, to get tested, or to participate in contact tracing. And our role, our job is to make sure we're engaging with leaders who are trusted in the community. So what we know about how and where disease transmission is more likely to occur, we know it's much more common among household members, indoors without the use of face coverings, especially at large gatherings, not wearing face covering in general, in places where 6 feet of distance cannot be maintained. So what's the city doing? There's been a huge increase in the testing infrastructure. So the city is making sure that testing sites are located throughout the city, but particular focus is being placed on priority neighborhoods where there may not be as many resources or where there are higher rates of disease, mobilization of contact tracing to these sites, more support than ever for people who test positive and their close contacts. We're continually issuing guidance as it gets updated. This is a really evolving situation, and there's so much that's still not known about the virus, and we're learning new things all the time. We are providing support to community members and community-based organizations, distributing face coverings and educational materials, and we're working closely with the healthcare community and long-term care facilities to provide support and education. We're also trying to be very transparent. We're sharing more case data than ever before, and I think we really appreciate how people want to know the information and how important it is to share. So in terms of things that you can help us do to stop the spread, please amplify the following information with your networks. People generally have been trying to socially distance and remain home, but we know during holiday time that may not be the case. And so please remind people to avoid travel and non-household gatherings during the upcoming holidays, and to continue to practice the core 4 prevention actions. So staying home if you're sick, or if you've tested positive, or if you've been in contact with someone who has COVID. Continuing to wear face coverings both indoors and outdoors, keeping 6 feet of distance from others, washing your hands, and getting tested often. Testing is easily accessible, and people can find out information about where to get tested from the Department of Health website. I know we're talking about COVID, but I'd be remiss not to mention the importance of getting the flu shot as well. Flu kills thousands of people every year, and flu and pneumonia has always been one of the leading causes of death in New York City. And on top of that, to have flu at the same time as COVID could be particularly dangerous and also confusing in terms of the overlap in symptoms. So please encourage people to get their flu shot now. It's not too late. The sooner you get it, the better. And now I wanted to switch gears and talk about vaccine. So COVID infection can be very serious. You know, I think everybody knows that. And in terms of just thinking about, you know, we've done work to look at what are major causes of vaccine hesitancy, and what can be done to address vaccine hesitancy. And the two major reasons why people are hesitant to get vaccine, whether it be COVID or any other vaccine, the two most important causes are lack of perceived risk from the disease, and then secondly, concerns about vaccine safety. So these are two key areas that we need to address, and we need to address vaccine hesitancy through being transparent. So sharing what we know and what we don't know, providing information so that people can make an informed acceptance of the vaccine, open and honest communication, as well as contextualizing the history of harm leading to mistrust in safety. So I'm going to go a bit deeper and in terms of messaging that you all can share. And the health department is working on more resources that we can share with partners in terms of how to have these conversations and talking points, because it's a lot to know, and information is rapidly changing. What we do know about COVID infection is that it can be very serious. We all know it can cause hospitalization and death. And people sometimes think that this is important just for people at high risk, so people who are older or who have certain underlying medical conditions, but obviously it can infect people of all ages, and people who recover of any age can actually have long-lasting symptoms even after they recover. But getting vaccinated, once it's available, can help protect you, your family, and your community. And delaying the vaccine increases your risk of infection and serious complications from COVID. So we want people to learn more about the vaccine, and people should use trusted sources to learn about the vaccine. So talking to medical providers or trusted sources in the community, including everyone on this call here. And we will also, we have information on the Department of Health website. There's a lot of misinformation out there on social media, and we want to steer people away from that. So the health department, we're committed to transparency, and guidance on our website and new information will be updated as soon as we receive information. So what I can tell you about, there are lots of questions about who is eligible to get vaccine and when. So there's a lot not known yet, but what we do know is that the initial priority group will be healthcare workers and long-term care facilities, including staff and residents. So that will be happening within the next few weeks. Other priority groups that will be next in line include some order of essential workers and people that are essential workers because they aren't able to stay home, and it's harder for them to distance, and also people who are at high risk for serious outcomes or complications from COVID. So that includes people aged 65 years and older and with certain underlying medical conditions. So how well does the vaccine work? Well, we've had really incredible news that many of you have probably heard. The Pfizer vaccine, which has just received approval, and the Moderna vaccine, which is in the process of being reviewed, are about 95% effective in preventing COVID, which is really incredible. That's much higher than many other vaccines for other diseases, so we're really thrilled by that. We know that for those two vaccines, at least, you will need 2 doses of the vaccine separated by about 3 to 4 weeks. And initially, the vaccine will just be approved for adults, and that's because studies haven't yet been done in children. And there's a lot that we don't know. We don't know how long the vaccine protection will last. So we don't know if it'll be like the flu vaccine where you have to get it every year, or maybe there won't be a need for future vaccine if protection is sufficiently long lasting. We also don't know whether the vaccine will only protect the person who's vaccinated or if it will also protect others around them. So we're still learning more about that. We do know that it will protect the person who gets the vaccine. To clarify, we just don't know, will it also prevent them from spreading the virus to others? Tons of questions about vaccine safety. Again, this is one of the biggest drivers or reasons why people don't want to get vaccines. So for background for all of you, clinical trials include tens of thousands of participants in diverse populations, and that includes Black people and other people of color, people of adults of all ages, including age 65 years and older, and people with high-risk medical conditions. And there is extensive safety review. Clinical trials indicate that approved vaccines are safe. So the Pfizer vaccine has been shown to be safe with no serious safety concerns identified from the phase 3 trials. And likewise, the same was found for the Moderna vaccine, which we hope will get approval shortly. More details have been released for Pfizer vaccine as it's been approved, and there were no specific safety concerns identified by age, race, ethnicity, or medical comorbidities. And the vaccine's safety monitoring doesn't stop there. It continues extensively after vaccines are approved, often for years, and this goes for all vaccines. And people should be reassured that if any concerning safety signals are identified, they're rapidly investigated and action would be taken. But there, again, there's been tens of thousands of people who have received these vaccines and no serious side effects have occurred. What has been found is that the vaccine can cause mild to moderate side effects, and that includes things like injection site pain or redness, tiredness, headache, muscle pain, things that can occur with other vaccines, but the symptoms may be a bit more moderate, similar to people who have gotten the shingles vaccine. So people might need to plan to recover for a few days if they're feeling very tired, and that's not to be unexpected. But important to note, one misconception is COVID vaccine cannot give you COVID infection. Just the two other things I want to note, people after they get the vaccine, everyone still needs to practice the core 4, that we're all familiar with: staying home if you're sick, distancing, wearing a face covering, and hand washing after vaccination, just like everybody else does. And lastly, just to mention that when you receive a vaccine, your privacy will be protected. I know there's a lot of concern around privacy issues. So I will stop there, and I'm happy to take any questions.
Thank you, Dr. Rosen. We had a few come in while you were speaking. One question is if faith leaders are considered to be essential workers by the city, so will they be able to receive the vaccine before the general population?
That's a great question. I don't want to give the wrong answer, and it's not something I'm entirely sure of. I think there are still lots of conversations happening about who exactly fits into the essential worker category. So I'm not sure that they are considered part of that group. Not that faith workers are not essential, but I think that's to be determined. I know these discussions are still happening, and once it's clear when essential workers will be vaccinated and who's considered an essential worker, that is information that will be posted on our website.
Great. And the second question was if the second dose of the vaccine is the same as the first, or if they're different in any way.
That's a great question. They are the same. They're the same vaccine, and so it is important to note we are hoping that there'll be 2 vaccines that are approved shortly. So we know Pfizer already is approved, and we're hoping for Moderna shortly. People who get a dose of Moderna will need to get Moderna again for their second dose, and likewise for Pfizer vaccine. So people should stick with the same brand that they had, but in terms of what you're receiving. It's the same for the first and the second dose. The symptoms that people can have after vaccination may be more pronounced after actually the second dose.
Good to know. We do have a question from Reverend Tom Venkis.
Doctor, thank you for that presentation. What is the process by which they determine the longevity, the effectiveness of the vaccine? If it's good for 6 months, a year, what's the process?
So there are different types of studies that are done to determine how well a vaccine works, and typically it can be a combination of two different ways. This is one way is by testing people's blood over time. So people in studies testing their blood after they get vaccine to see how long certain antibodies, for example, last. There are also studies that look at rates of infection among people who are vaccinated versus those who are not vaccinated. So, over time we may see that, hopefully we'll see that people who are vaccinated continue to not develop COVID infection, but there are studies to look at that. And because, people haven't been vaccinated for, long periods of time at this point, we need to wait to see how long the protection will last.
Thank you.
Sure.
We had two more quick questions, Dr.
Sure.
Rosen. So one is, what's the difference between Moderna and Pfizer vaccines?
Sure. What I might do, just for the sake of time, because it's a little bit more involved, is refer you to, I can share a website with the organizer that has nice, simple explanations of how these vaccines are made, and there are so many different vaccines being tested, and many of them are slightly different. But if it's okay, I'll share a website that I think is a great resource to give explanations about different vaccine types.
Great, absolutely, and we'll make sure to send that out to everyone who registered.
Sure.
The last question was, why is it important to continue observing measures like masks after being vaccinated?
Yeah, I'm glad someone asked this. So we know that the vaccine, if in people who get vaccine, based on the studies that have been done, the vaccine is very effective in preventing people from getting sick from COVID infection, and even more effective at preventing serious illness. So even if someone were to get infected after being vaccinated, they're much less likely to have to be hospitalized or to die from the infection. Two things. One is no vaccine is 100% effective. But I mean, these vaccines are, the vaccine effectiveness is incredibly high, but again, nothing is 100%. So, if the vaccines are 95% effective, 5% of people can still have symptoms of COVID. And so we know that they could spread infection. What we also don't know is, we know that the vaccine can protect people from feeling sick, but with certain infections, even in vaccinated people, for certain infections, a virus or bacteria can still essentially live in your nose, or what we call the nasopharynx, the back of your nose. And it doesn't, if you're vaccinated, that the goal is that you won't get infected, it won't get into your bloodstream. But if it's living in your nose, if you cough or sneeze, you could still spread it to other people, even if you yourself won't get sick from it. And we don't know yet. The studies that have been done look at have really focused on protecting someone from getting sick, and we don't know yet whether there will also be protection against someone's carrying the virus and the ability to spread it to other people. So until more is learned, the masking and social distancing will be recommended for everybody. And really, this is the next several months to years, it's going to be such a critical time in terms of ramping up population level immunity and really trying to stamp out the virus.
Thank you. We have had questions coming in, but how are you doing on time?
I'm okay.
Okay, great. One question is about the logistics of the vaccination. So is thought being given to mobile vaccination units that can be collocated at places folks already go for essential services, like a food pantry at a house of worship, for instance, which, since households are regulars at pantries, might also increase uptake of a second dose?
Yeah, it's a great point, and I know a lot of work is going into thinking about where vaccines can be distributed. The challenge for these two particular vaccines has to do with storage. Some vaccines can just be stored in a regular refrigerator, and that makes it so much easier to do mobile vaccination. But these vaccines require special freezers, and for one of them, the freezers they're so special that even really the only places you tend to find them are hospitals, and not even all hospitals have them. So a lot of work has been done around getting these special freezers to hospitals, but there are limitations in terms of storage, at least for the Moderna and Pfizer vaccines. But we're hopeful that with other vaccines, there will be, the storage won't be as much of an issue. The health department is still, I see there's a question about points of dispensing or pods. I think the city is still thinking about whether and when pods will be used, and if so, where they will be held. So that's still TBD, but I believe the discussions are focused around making sure that if they're done, they're in priority areas, or areas where they will be able to reach priority populations.
Great. Joe, I see your question that you put in, and there's actually a great graphic put out by the health department that I can share in response to knowing if somebody is more at risk for complications from COVID-19, how to identify themselves as that. There's another question about, will vaccines be distributed first in hot zone or high fatality zip codes in New York City?
So it's the Advisory Committee on Immunization Practices, or ACIP. They are in the process of making the recommendations for which groups should receive vaccine first. And we know that it's high-risk healthcare workers and long-term care facilities first. So this would be for all healthcare facilities and long-term care facilities, not for specific areas. And then likewise, the next groups would be essential workers and people that are at high risk for COVID complications, regardless of where they live. In terms of what comes after that, I don't know. Ideally at that point, we hope that there will be enough vaccine for the general population, and so everybody could get it at once. But I think in terms of making sure, I know there's a lot of attention to making sure that there is good access in these hot zones or areas that are at high risk for COVID transmission.
Thank you. And a question is, how would you know which of the two vaccines is best for you?
So they both have basically the same effectiveness. It comes more down to where you're getting the vaccine. So the hospitals will typically be the sites that are giving the vaccine that requires the special freezer, whereas pharmacies and other sites would be giving vaccines that require a closer to normal freezer. So I think it will really just come down to where people get their vaccine, but I don't anticipate that there would be any preferential recommendation for one vaccine over the other. Really just has to do with storage.
Excellent, thank you. Are there any other questions that someone would like to voice? I know I've been reading out of the chat, but if anybody would like to voice some.
Doctor, I'm just curious if the city will target the initial vaccines to hot zone neighborhoods and neighborhoods that have had a high percentage of infections and fatalities, or is it just going to be made generally available?
So the initial, once it's available to there's enough for the general public, I think, that ideally it would be made available, if there's sufficient amount, it'd be available to everyone at the same time. But, I think if we are still in a situation where once the essential workers and people at high risk for complications are vaccinated, and there's still not enough to go citywide, then that probably is one of the strategies that people are thinking about. But we know, in terms of where people are at highest risk for complications of COVID, so people with certain underlying medical conditions, there is certainly an overlap in terms of the COVID hot zones, and people with underlying conditions are among the top groups to receive the vaccine.
We had a question come in about the 2 doses. Will a record be maintained on first vaccine so the person can get their second dose in a different location, or how will that documentation work?
Yeah, so really important point. There's a citywide immunization registry where providers who vaccinate are required to enter the dose into this, the database that's maintained by the health department. And we do that. It's really important because that way, if someone does go to another provider, they'll be able to see, the provider will know exactly which type of vaccine the person received to make sure that they get it again the second time. The reality is that with this particular vaccine, the way it will be distributed, probably most people will be getting the first and second dose from the same location.
Thank you. All right. Thank you so much for your time, Dr. Rosen. We appreciate the wealth of information you've shared. Sorry, we just had one more question about if there are other pharmaceutical companies creating the vaccines as well. And I think the short answer is yes, correct?
Definitely. And yes, so that is correct. There are lots. And I think the document that I am going to be sending you that has simple explanations about the different types of vaccine will sort of cover that as well. But I really wanted to thank all of you. We're so excited to get this invitation and really see your group as just such an important partner and such an important trusted messenger for your communities. So thank you so much, and we'll make sure to share resources as we receive them with you, and would love any feedback that anyone has in terms of reaching out to communities. Thank you.
Thank you. Thank you very much.
Thank you so much, Dr. Rosen.
Take care. Bye-bye.
Bye. All right. This is not the conclusion of our presentation for today, though. So we thank Dr. Rosen for being here and sharing about the vaccine. And now I'd like to transition over and talk about your congregation specifically and how you're communicating during the pandemic. So we will distribute the slides that are hyperlinked with resources, and any links that Dr. Rosen sends over, we'll make sure to put in the email, the thank you email that you'll receive. That might take a little bit of time, so it might not come out today, but hopefully tomorrow you'll get the email with all of the information put together. So I'm curious about how congregations have been responding to COVID-19 and maintaining their communications. We've held numerous webinars throughout the spring to kind of get all of this up to date and help congregations write their risk communication plans and make sure that they were well set up to continue communicating throughout the pandemic. So these are some activities that we know congregations have been doing during the COVID-19 response. We've seen you maintaining situational awareness of the pandemic, communicating important updates with your congregants in your community. You've been adapting your regular operations for virtual and COVID-safe practices. We've held a few webinars on that as well, and we've heard really creative ways that congregations have stepped up to be able to provide that spiritual and emotional care to their congregants during the pandemic. You've been providing disaster spiritual care for your congregants and community. Some of you have expanded or sometimes even started emergency food distribution programs. The city had an open enrollment call for if you'd like to begin a food distribution program within your house of worship, and we saw many of you register there. And many of you have also advocated for disproportionately impacted communities with government and other key stakeholders. This is just a synopsis of a few things, but we know that you've been doing beyond that. And I wanted to give you an opportunity to share in the chat if there have been other activities that your congregation has been doing to support COVID-19 response across the city. And that's just something for us to be able to read and review and to know what's happening and to keep a pulse of what's happening in the congregations in the city. All right. And we did have Dr. Rosen for a bit longer than I thought we would, so I'll try to get through these slides efficiently. But here we have the COVID-19 Zone Finder tool. So I hope all of you are aware of this tool, but if you aren't, we've created this video to show you how the website works, and we'll give you the hyperlink. So New York City has a series of hot zones currently, and they change based on COVID-19 indicators, so infection rates, positivity rates on tests. And so these zones are changing, and you can see the date that they're updated on the website. So this is how it would work. You would type in an address and it would tell you what zone you're in, and subsequently what restrictions are in place if you are in one of the zones. So for houses of worship, I know the text is small here, but in a yellow zone, you may remain open at 50% maximum capacity. And for your non-worship gatherings, because we know that houses of worship use their space for many things in the community. So for non-worship gatherings, you would look at the second category. So non-essential gatherings must be limited in a yellow zone. NYDIS also has a series of guidelines that we've written for houses of worship in each zone. My colleague Susan has put the link for the zone finder in the chat, which is very helpful. And so those resources will be sent out to you after the presentation. All right, so we did have a shortened link as well on the slides once you receive the slides in the email. So talking about congregation communications during COVID-19, we know that you've been doing it, but formally we call this crisis and emergency risk communication. So communicating about COVID-19 and the pandemic is inherently different from your regular communications that you would put out as a congregation. So information about potlucks and meetings and youth groups, that information goes out regularly, but I know many of you all have experienced the shift in communicating about an emergency and providing risk communication to your congregants. Awesome, I see in the chat that someone is sharing the work that they've been doing to communicate. Absolutely. So the purposes of this specific crisis and emergency risk communication in general is to prevent further injury or death, to prevent loss or damage of property, to restore and maintain calm, and to engender confidence in the response. So COVID-19 has impacted everybody in the city in some way, and it's changed the way inherently how we live our lives day to day. And for faith leaders, we find it important that they learn about CIRC and the best practices of crisis and emergency risk communication, because you're a trusted source of information for your community. You can restore and maintain calm in ways that other leaders in your community can't. You can also direct constituents on how they can help. You are a trusted word for them on ways to contribute helpfully after a disaster or during an emergency. Faith leaders are able to mitigate delays in recovery efforts by knowing exactly what their congregants need and how their community has been impacted, and being able to communicate that up to key stakeholders, and you're through that able to speed up the recovery process. So some important communications for your congregants to receive during COVID-19. Many of you have been sending these messages out and understand how appreciated these messages are. Excuse me. But when your congregation's zone category changes, so if you find yourself in a yellow zone or a red zone, and if that changes, Excuse me one moment. Great. Sorry, let me just drink some water. All right. So if there is a confirmed case within your congregation, or if there is a COVID-19 death in your congregation, especially if you've been hosting in-person gatherings, learning that information directly from leadership and not something that spreads through the grapevine or through people sharing information is especially important. If your protocol for in-person gatherings changes during COVID-19, being able to share that in advance with people before they arrive to your space or your house of worship to know what to expect. That also helps them calculate the risk before entering the space. So if they know that you're going to be enforcing certain protocol, they're able to determine whether that is a risk that they are willing to take. Any press releases from the governor or mayor that impact COVID-19 protocol or plans that impact your congregation is also helpful to share with your congregants. And any informational articles about COVID-19 research and findings, if they're from a trusted source, is also useful for people to know. All right. So my understanding is that many of you have been doing this communicating in the last year. And so I'm curious to know how many of you have written a formal risk communication plan. So do you have a written document that shares the roles and responsibilities of your staff during a crisis? Have you identified any agreements for information release? Have you written down your information sources as a list of here are the sources we look at for information? Do you have your contact information? I'm sure that you have contact information for your partners in your community and also for your team members and your congregants, but is this formally maintained? Is this database something that multiple people are trained to manage and have access to? And have you formally identified exactly which vehicles or modes of communication you utilize for specific communications to your congregation staff, your clergy, or to the public? And also, do you have any message templates that you've written for pandemic scenarios? This is kind of a step ahead, but many congregations have written templates of a message that would go out if one of the leadership were to develop COVID-19, or if there were to be a death from COVID-19 within the congregation. And so those are things that you can think about in advance and put together with your team that would help during a crisis. I'll quickly review the 6 principles of emergency communication messaging. So they are to be first, or as I like to say to faith leaders, be early in your communications. As I mentioned before, if there were to be a death in your congregation due to COVID-19, you would want people to find out from your leadership, before having to find out from others. So as early as you can be with that information. Or if your congregation were to suddenly be in one of the hot zones, you would want that information to come from you and for people to find out from you. The second point is to be right or be correct, double checking your information and identifying where your sources are a good way to do this. In addition, often you don't have to rewrite a message. If the governor puts out a message that is very clear on how it'll impact houses of worship, please repost that message. And that way it also increases your credibility, which is point 3, being able to cite your sources. And you as faith leaders also know and are in tune to what trusted sources are for your community. So if you know that the Mayor's Office of Immigrant Affairs is a trusted source for your community, they often are putting out the same information that other mayor's offices are putting out. And so you're able to share that information with that as a source. The fourth point is to express empathy. This comes naturally, I think, to faith leaders in being empathetic to the impacts of COVID-19 on your congregants. But for emergency management professionals, this one is also included to be a reminder. The fifth point is to promote action. So sharing how your congregants can engage in the news that they're receiving, whether it's a call to prayer or if it's a call to organize, making sure that we're guiding their emotional response in any action that they can contribute. And the sixth point is to show respect, utilizing your platform to be respectful of the authorities that are providing the information, and not using your platform to tear down or incite distrust. So a quick slide on internal communications. This is a series of questions, so I'm happy to have some people type answers in the chat along the way if they find a particular question meaningful to them. So my first question for you all to consider is, what pieces of a risk communication plan does your congregation already have in place? Is it a fully written, fleshed out with all of the bullet points that were listed before? Or do you have certain pieces put together, and now knowing what all the different pieces are you going to be able to put them all together in one document and have a working document? The second question is, what is a key information source for your congregation for information regarding COVID-19? I love to hear your responses in the chat because sometimes I learn about different sources of information that people are utilizing during the pandemic, and that's useful. Or your response here might even inspire other congregations to utilize different sources. Another question is about receiving any guidance or ordinances from your organizing religious body or judicatory body. Many judicatory bodies have put out information regarding COVID-19, so making sure that we're utilizing those as a resource. And internally among your leadership, what is the platform that you're using to communicate COVID-19 updates? Some congregations find WhatsApp groups to be effective here, whereas others, I know one congregation said that they actually utilize Facebook, a Facebook Messenger group, because that works well for them, knowing that it's on their phones. And others use email, but it just depends on what works for your community. And the last question is, what is the protocol your leadership have agreed to follow in the case of one of them being diagnosed? So if you don't have very clear instructions about what it looks like if somebody is diagnosed positive with COVID-19, especially if you have any of your staff or leadership coming into the offices or on the premises, this is very important to hammer out and make sure that we have a protocol to follow and that they are all well aware of the protocol to follow if they test positive. All right. I'll keep moving. About sharing information with your community. Also, in light of news about the vaccine, how are we going to share information about the vaccine with our community? Have you begun to prepare for vaccine communications and what that looks like? I'm appreciative that we had Dr. Rosen on the call because she's sharing some links about vaccine information, and you can add that to one of your trusted sources of information. My understanding is that there's a health department page specific to the COVID-19 vaccine, as the same on the CDC website. So those are two new web pages that we should be looking at for updates. But what platform do you use for COVID-19 risk communications with your congregants? It's been different for everybody during the pandemic and what works for them. I know with elderly congregants, I've also heard of pastors handwriting letters to some of their elderly congregants and allowing that to be a means of communication. So I do love to hear how people have adjusted to everything being virtual and online, and ways that they've empowered their elderly congregants to utilize technology, and also ways that they've found to get around technology and communicate with their congregants. So if you have any insights or tips there, I would love to see those in the chat, and maybe I can read them out. All right, and we have Anna from the health department is sharing a website about the COVID-19 vaccine page. Awesome, for the health department. Thank you, Anna. All right. So I also would love for y'all to think about what information you have been providing to your community about COVID-19 so far, and what it would look like if you started to share information about the COVID-19 vaccine. Would this be new for you to suddenly be sharing information about the COVID-19 pandemic, or is this an expected part of the messages that you've been sending throughout the vaccine? And how can you start to kind of build your platform to allow people to become used to receiving that information from you? All right. And not to be underestimated is determining who writes the message, approves the message, translates the message if necessary, posts the message, and also fields the responses. If you have the same person answering all of those tasks, then we might need to look at how we can build out that team of message writing and publishing for your congregation if possible. I know that there aren't often many people to choose from, but how can we be training people up to form a team? All right. All right, so here we've identified a best practice of forming a team within your congregation who stay appraised of COVID-19 news and updates, especially about new information about the vaccine that we know is changing every day. So formally identify your information sources, create protocol for information sharing with your congregants, and be prepared to combat misinformation that's spreading in your community. So every day there seems to be a new headline that's grabbing our attention about the vaccine. So do you have a group of people who are dedicated to engaging with this? It might help if some of them have a history in healthcare, if you have any retired nurses or other types of healthcare professionals in your congregation who are interested in serving with their time and energy on this team. That would be very helpful to be able to read past the headline, find the source, and find the scientific information to combat misinformation and to spread accurate messaging. All right. And a thought exercise about how will you encourage your congregants to get vaccinated will end here, and start thinking about how faith leaders and clergy can step up and encourage congregants to get vaccinated when approved by the FDA. So one example is leading from example. So we have an example of this already that came out in the news about the former presidents volunteering to get the vaccine publicly to prove its safety. But how are you using your platform as clergy or a faith leader to model trust for the vaccine? So are you planning to receive it, especially if faith leaders are identified as an essential worker in the city? Are you prepared to receive that vaccine? And maybe even documenting it and sharing what that experience was like to engender trust in the vaccine. Or sharing about one of your family members who is in a high-risk category receiving the vaccine. So sharing our stories about how we're getting vaccinated and how it's helping. All right, so we have resources at the very end. We'll be able to send this out in the slides. Are there any questions that I'd like to address before we end the webinar today? All right. I must have been a very thorough presenter. Thank you so much for joining us. I'll just slide through these resources at the end because our time has ended. And we will be sending out this information to you all. So thank you for joining us today. This webinar is supported by the Fund for Public Health in New York City and the New York City Department of Health and Mental Hygiene. We will be sending out the links for you all to submit your evaluation and to get the information from today's webinar tomorrow. Take care, everyone. Thank you for joining us.